Dr. Dean coming at you to talk about neck exercises today. And this relates to things like cervicogenic vertigo and also concussion, and recovering from concussion. So there's some good data that shows neck exercises, particularly anterior neck exercises, to reduce the chance of getting a concussion and reduce the time it takes to recover from concussions. And so they're a great thing to add to your program if you've had a concussion, or if you're an athlete, you're certainly a boxer or someone who's getting hit in the head, that kind of thing. And doctors are catching on more and more and prescribing, if you will, neck exercises. But what I see a lot, whether they're chiropractors or medical doctors, is they're prescribing these neck exercises like chin tucks and things like that with the person vertical. And I like that they're thinking about neck exercises. I don't like that they're not understanding biomechanics and physics. And so I want to point out a couple of things, not because I'm a know-it-all, but because I want to help. Because there's a huge difference between doing neck exercises vertical, like sitting up, or laying back, where there's actually weight on your neck. And so what's the difference? Well, when we're standing, there's very little pressure on our neck muscles. I'm going to demonstrate this by pointing out on Fred here, our lovely demonstrative skeleton, that he has no muscles. And so the weight of the skull is just sitting on the vertebrae. And that's what's happening to us when we're standing here, or when we're sitting, or when we're vertical, which is most of the time in life. So to do this exercise and tuck your chin doesn't really work these muscles very much at all. And furthermore, this concept of tucking your chin and looking down is what people are doing all day long, looking at phones, right? And we're trying to get them to not do that. So do you think that they're really weak at doing this and tucking their chin and looking down? No, most people spend way too much time doing that anyway. So what we want to do is we want to lay back so that we're what we call supine, so facing up, laying on the floor or a couch or your bed or something. And then in this position, gravity is pulling our head back. And so these muscles really have to work in order to tuck your chin in. And so the two exercises that would be most common would be chin tucks, where you're kind of doing this thing, and then chin tucks while you're lifting your neck up and down, like a neck crunch, if you will. We can also do things where we tuck the chin in and look at each side and so forth. And you will discover very quickly if you have weakness in these muscles. When you lay down, try to tuck your chin in and lift your head up 10 times. And if you can do 3 sets of 10 with no problems, you're good. My guess is, especially if you've had whiplash injury, a concussion, things like that, these muscles are very weak and you could benefit from these. Now, I'm not saying everyone should go out and do these, and you should probably consult with a doctor or a chiropractor before doing these on a regular basis anyway. But if you've been prescribed neck exercises, there is a huge difference between doing them vertical, which is quick and easy, and people, oh, just tuck your chin like this, and laying down, which is actually loading your neck, right? For those of us that are old enough to remember those commercials in the 90s, there was all kinds of ab gadgets. You know, the commercial started out with, you know, do you have neck pain when you do ab crunches? And the person would do some crunches and they'd be like, oh, my neck. Well, now you can use the Ab Rocker 3000, and it had like a little pad that would hold your head here, and then you'd put your arms on some bars and you rocked like this, and it held your head for you. So it kind of convinced us that you're not supposed to have neck pain when you do ab crunches. No, you absolutely are. You're supposed to feel it in your neck. The idea is to not let your head go like this with your chin out. The idea is to engage your neck muscles and kind of keep your chin tucked in when you're doing your crunches. But one of the benefits of doing crunches is strengthening the anterior neck muscles. So absolutely, you should feel it in your neck. That's a perfectly normal thing. So how do neck exercises work? Now you know.